Hey, this is Dr. Danyo from North Atlanta Hair Restoration. I want to talk today about some scarring alopecia. So we had a case recently where the individual had a history of long-standing folliculitis, and the folliculitis was mainly kind of on the top of his head. And this is very common with some of our African-American patients because of the curly hair. They're kind of chronic ingrown hairs that produce long-term inflammation. So unfortunately, the long-term inflammation actually caused some hair loss. So what we did today is we actually did a test case of about 75 to 80 grafts, kind of right in the middle of where that alopecia is. And we're doing a test graft or test graft case because we want to know if the follicles are actually going to survive. We don't want to do a massive case and then have issues with survivability. So doing a test case and waiting about 6 to 8 months to see how those grafts grow is generally kind of the best approach when dealing with different types of scarring alopecia. I'm going to have another podcast coming up where we're going to describe the three main components of scarring alopecia, but this one was actually related to more of an infectious, or what we call neutrophil-origin scarring alopecia. And the neutrophils cause this severe inflammation and almost tunneling under the skin, causing the hair loss. So if you look at the case that we did, the test case, you can see the grafts really kind of right in the middle. You can see the extensive hair loss that extends from the middle of his scalp into the kind of the periphery right here. Again, this is kind of an exciting time for him to get past this extensive scarring, and he otherwise has no evidence of male pattern hair loss. This is all related to the scarring alopecia. So we'll keep you posted with the results at a later time, but it's going to be about 6 to 8 months from now.